Hello friends, in our series of PSM recall questions from the December FMG 2020 examination, we are here with another question, and the question is contraindication of the device given in image. Now here we have to do two functions. The first is we have to identify the image and then we have to look for its contraindication. So the image given is of copper Iucd and this is placed inside the uterine cavity. And how we can say it is copper Iucd? The thread is hanging in the vagina, so it is an Iucd. And the second is you could see the copper coil on the horizontal and vertical arm. So it is your copper Iucd 380A which is kept in the uterine cavity. Now the question is, what are the contraindication for this device? Now first is PID. Pelvic inflammatory diseases. Yes, if an infection is present, we are not going to insert any foreign body or any device from externally. So yes, PID is one of the contraindication for putting Iucd. Hypertension. Usually in the hypertension, we also avoid putting Iucd because the most common side effect of Iucd is heavy bleeding, and hypertension further precipitates the heavy bleeding. So again, this could be your contraindication. Now in lactation, device is not a contraindicated. We can use the device safely. So this is not a contraindication. Migraine, again in the migraine, it is not a contraindication where contraceptive pills, oral pills are usually contraindicated in migraine. Iucd, it is not contraindicated. Now if you have to choose the best or the one option out of the PID and hypertension, then we'll go with the PID because PID is supposed to be the absolute contraindication for putting Iucds. Absolute means at any cost we are not putting the device. So what are the various other absolute contraindication for Iucd? One is pelvic inflammatory disease. If there is a past history of ectopic pregnancy, if there is a history of undiagnosed bleeding per vagina. If a lady is having a history of bleeding per vagina irregularly which is not diagnosed, so we are not putting Iucd until unless we can diagnose what is the cause of that bleeding, because Iucd is further causing the menstrual irregularity and we may be confused. And the next is undiagnosed or suspected pregnancy. If you are suspecting a pregnancy in a woman, again we should not put Iucds. So these are few absolute contraindications. What are the relative contraindications? Relative contraindication means that preferably we should not put the device, but if it is required, we can try. And those relative contraindications are if there is a past history of pelvic inflammation, in the presence of anemia, history of multiple sexual partners, if there is uterine malformations or presence of fibroids or any space occupying lesion in the uterine cavity, in the presence of hypertension, diabetes mellitus. These are few relative contraindications. So answer to this question, that contraindication for the copper Iucd which has been shown in the image is pelvic inflammatory diseases.